Okay, so this is Mr. Rodney Davis. He's a 54-year-old male who came in with chest pain and shortness of breath while he was shoveling his driveway. At home, he took nitroglycerin and aspirin, but neither of those relieved the chest pain, so they called 911 and he was brought into the ER. When he arrived, he was diagnosed with a STEMI and went to the cath lab in under an hour, which is good, and he received a percutaneous transluminal coronary angioplasty with stent placement in the left anterior descending coronary artery. He has a history of hypertension, coronary artery disease with angina, and asthma, and he is allergic to penicillin, peanuts, and sulfa drugs. He had an allergic reaction to the contrast dye that was used in the cardiac catheterization. It was a latent type of reaction, so we gave him diphenhydramine, but that didn't really seem to work. He also started showing signs of anaphylaxis, so we gave him epinephrine, and that helped with that, take care of that. Later on, the insertion site developed a hematoma, and it also had some external bleeding, so we applied pressure, and that was all that was really needed to help stop that and keep it from getting worse. He also went into slight cardiogenic shock. We gave him dobutamine and fluids, but that wasn't necessarily helping as much as we'd liked it, as much as we would have liked it to, so we gave him some norepinephrine, and that helped significantly bring his blood pressure back up to normal. As for the actual patient, he has ANO times 3 with no facial drooping and present facial symmetry. His heart sounds have been normal, S1, S2, with a capillary refill less than 3 seconds, and +2 pulses in the bilateral radial and dorsalis pedis. The lung sounds have been normal and clear in all the lobes, no wheezing or rhonchi, anything of that sort. He is on a low-sodium diet. He has an indwelling urinary catheter. His skin is not intact due to the insertion site, but that's the only part that isn't intact. There's no pressure ulcers or any kind of sores or anything that I've seen. And yeah, that site is in the right groin. I don't know if I said that before, but that's where the insertion site was. He is on room air. He used to be on like 2 to 4 liters nasal cannula, but he's come off of that. He doesn't have any kind of shortness of breath or anything anymore. And he has a central venous catheter with IV fluids running via an infusion pump. He also has an arterial line that monitors his arterial pressure.